Hi, Dr. Hagmeyer here today, and I have some great information I want to share with you. With the rise of autoimmune conditions, thyroid problems, depression, allergies, researchers have really been spending a lot of time studying the gastrointestinal system, and more specifically, studying how something called a leaky gut can often lead to many of these conditions. Now, leaky gut is nothing new, okay, but conventional medicine is really now starting to refer to it and really to identify it as a major cause of just a slew of health problems, okay? Now, it's important to know that the cause of leaky gut obviously varies and is different from person to person to person. And so in today's video, I want to give you some of the most common causes behind a leaky gut. And really knowing why you have a leaky gut can help you address and refine your approach to restoring gut health. Now, I'm going to tell you, I work with a lot of different kinds of patients. I work with diabetics, and I work with people that have autoimmune disorders like lupus and multiple sclerosis. I have a lot of patients who have celiac disease. I have patients who have fibromyalgia, people that are in chronic pain, people that have migraines, people that have cancer, people that have a variety of different thyroid problems. And I can tell you almost in every single one of these cases, to some degree, the things we're going to talk about in today's video is applicable, okay? So, and identifying what cause of this leaky gut is affecting you is something that really needs to be addressed, okay? So now, if you've never heard of a leaky gut, or this term leaky gut is new to you, then understand this. Leaky gut, otherwise known as intestinal permeability, is a condition in which the lining of the small intestines becomes inflamed. And after it becomes inflamed and it becomes damaged, it becomes porous. And becoming porous allows undigested foods and proteins and bacteria and molds and viruses and funguses and environmental toxins into the sterile environment of our bloodstream, okay? Now, once in the bloodstream, your body's immune system is going to see these things. And now what's going to happen is there's going to be a triggering and a cascading of inflammatory reactions that takes place in your body. And there's going to be a whole list of different symptoms. Now, what I try to tell my patients is think of think of the Great Wall of China, for example, and think of a neighboring country that's doing everything it can to try to get in, right? You have soldiers that are just kind of banging down this wall with pickaxes, and they're trying to entry so that their soldiers can all flow in. That's a leaky gut, okay? Chronic conditions associated with a leaky gut, like I said, are going to be things like depression. They're going to be things like joint pain. They're going to be things like skin conditions and eczema and psoriasis. They may be things like asthma, breathing issues. They may be chronic ulcers in the mouth. They may be autoimmune diseases. And of course, they may be all sorts of irritable bowel disorders or symptoms. And there's a whole lot of other things. So those are just some of the more common ones. So let's jump into these things that really cause a leaky gut, because again, this is so important. This is why I'm doing this video, okay? Number one is obviously the diet, right? We've got to talk about diet here. Most people blame poor diet, and rightly so. As many popular foods obviously damage the gut. One of the biggest foods that I find are things like gluten, okay? In particular is associated with gut damage. But you're also going to see things like dairy. You're going to see things like processed foods. You're going to see foods that say enriched. You're going to see things like excess sugar. You're going to see things most likely in all of our fast foods that are these common culprits. And of course, things like excess alcohol is going to help break down those barriers. There's also going to be things like taking a lot of Tylenol or taking a lot of aspirin, these things that we call non-steroidal anti-inflammatory drugs, NSAIDs, right? The next thing is infection, right? An overgrowth of H. pylori, which is a bacteria that can live in the stomach. It's very, very common. I see a lot of it in patients of my office. This can cause ulcers, and this can also cause a leaky gut, okay? Now, an overgrowth of other harmful bacteria, things like yeast and infections and parasitic infections and intestinal viruses, these again fall into this category of infections, again, all causing a leaky gut. Industrial foods, okay? The processing, especially of industrial foods, okay? So the food processing industry uses just a variety of different methods and just a variety of different preservatives that, of course, increase intestinal inflammation and, again, hence leading to this leaky gut. These are going to be things like the processing of wheat, the process called deamidation of wheat, all right, which makes it water soluble. They use a lot of high heat, a lot of sugars being added to it, a lot of alcohols being added to it. And so again, these are the things that are going to play a role in the foods we eat, leading to leaky gut. The next one is hormonal imbalances, okay? The gut mucosa depends on proper hormone levels for good health. when estrogen levels, progesterone levels, testosterone levels, or thyroid hormones are deficient or out of balance, this imbalance is going to contribute, again, to a leaky gut, okay? We already said this earlier, but medications, okay? Certain medications increase the risk of leaky gut. Now, we already talked about things like Tylenol and aspirin, but what you may not know are things like antibiotics, okay? Things like corticosteroids, right? If you're a person that's getting, you're in chronic pain and you're getting steroids into your joints, or you're a person, or even started out life as a child with lots of ear infections and respiratory tract infections, you could be setting yourself up for a disease process. And so it's not uncommon when I get on the phone and talk to someone, and I'm working with maybe a child that's maybe 11 or 12 years old, and we find out that this child had their tonsils taken out, they had tubes put in their ears, and the next logical question is, well, why were all these tubes put in their ears? And of course, they had ear infections. And well, why did they have ear infections? Because they were on lots and lots and lots and lots of antibiotics. Okay, so again, the point here is that many medications obviously cause a leaky gut. Now, a lot of medications, which you may not realize, also contain gluten, okay? They use gluten in a lot of different medications, but also a lot of vitamins. And this is a big thing that I see over and over with a lot of people, is that they come in and the very vitamins that they're taking contain gluten. So, oh my gosh, this is just a major, major problem for people that have a leaky gut. The next one is stress, okay? Chronic stress raises your adrenal glands, okay? And more specifically, it raises a hormone in your body called cortisol. Now, too much cortisol in your body is a catabolic hormone, and what that means is it's going to begin to break tissues down. And specifically, since we're talking about the gut here today, it is actually going to slow down the healing process of the mucosal lining. And that, again, can contribute to a leaky gut. Now, autoimmune conditions, okay, there are proteins that really hold the cells together. I try to tell people that if you can imagine that Great Wall of China, each one of those bricks is held together by mortar, right? And that mortar would represent structural proteins, specifically things like occludin, zonulin, and actin. And these proteins can be the target of an immune system's attack. And when that happens, again, it's almost like that mortar is starting to come apart. The wall is starting to come apart. And then again, that's the entry system into the bloodstream, which again then targets all sorts of inflammatory cascades. One thing I didn't talk about earlier is just how inflammation in the gut also can affect brain function. Okay, that is super, super, super important, because when there's inflammation in the gut, there's going to be inflammation in the brain. And so what we often see again is that gut-brain connection. Okay. So more and more research actually shows this is a very, very, very common pathway for leaky gut to cause autoimmune disorders like Hashimoto's and rheumatoid arthritis and hypothyroidism, and then again skin conditions like psoriasis. Now in these cases, the autoimmune condition begins to attack that mortar like I mentioned earlier. And again, this is going to be a strategy in terms of restoring the gut function. Okay, so if that's happening, there are tests that we use in our office that can help identify what is the cause of your leaky gut. Now, you've probably been hearing a lot about glutathione. Glutathione is probably one of my favorite nutritional supplements that I use with patients that have autoimmune disorders. But if you're not familiar with glutathione, glutathione is the body's primary antioxidant. It's necessary to defend the gut lining or repair the gut lining. It's necessary to defend the gut in terms of the immune system. And again, poor diet and smoking and birth control pills and inflammation are all things that really deplete the body's glutathione levels. Okay. Now, the next thing I want to talk to you about is environmental toxins. Okay, we're surrounded by toxins in the environment that we live in. Unfortunately, the world's becoming more of a polluted place, and some of these toxins have been found to break down the immune system's barriers. Okay, these are going to be things probably like you've heard of, like things like BPA or bisphenol A. These are going to be things like heavy metals, right? There's a lot of talk these days about how fillings, mercury fillings in our teeth are contributing to a lot of different neurodegenerative brain disorders. We also know things like vaccines. All of these poisons found in vaccines are another possible potential cause to a leaky gut. There are also things like parabens. There are things like molds. And then, of course, there's things like pesticides. So again, one of the best defenses against environmental toxins is really to make sure your body, again, is sufficient in these glutathione levels, okay? With, again, glutathione being that primary antioxidant. Now, if you've seen my video on glutathione, or I should say if you haven't seen my video on glutathione, you're going to want to go back and watch that video and where I discuss so many of the different benefits that glutathione offers. And then finally, in wrapping this video up, as it relates to, again, causes of leaky gut, there's a vitamin D deficiency, okay? I see this almost day in and day out. Any Google search on vitamin D and gut mucosal lining, or vitamin D in autoimmune system, basically has its role in terms of the gut from, again, just having good, healthy vitamin D levels, okay? So again, here's where sufficient vitamin D levels is really essential to preserving that gut integrity, okay? So now, by better understanding all of these causes that we just talked about, you're going to have more success in restoring health to your gut. You're going to have more success in restoring health to your immune system, and overall, your whole body is going to become much more healthier, okay? Now remember, 90% of your immune system lies in your gut, and with 1 in every 3 people dying today from cancer, don't you think this is an area of the body that really needs and deserves more attention, okay? I certainly do, and that's why I did this video, okay? So for more information on how to support leaky gut, the testing that we use in our office, or how to identify a leaky gut, you can either contact my office or you can email us. Hope you enjoyed today's video. I'm Dr. Hagmeyer, and take care.